I erred on the side of being extra cautious the whole time. I didn't go anywhere. When I would do groceries, I would do grocery pickup. I kept my family home. My name is Whitney Holmes. I'm a registered dental hygienist and mother of 2. So I got pregnant in March of 2021, had my son in December 2021. I was vaccinated prior to pregnancy, but then I received the booster while I was pregnant. Yeah, so I was concerned with, all the talk about infertility and this and that. I did my research. I entrusted all of my health and the health of my future child with my OBs. They said that everything would be okay, that there was no link to infertility whatsoever. That was my main concern. But I took the vaccines, first and second doses, and had no problems getting pregnant. I got my booster in October and had my son in December. I researched, I talked to my OBs, and they strongly recommended that any pregnant woman get the booster just because the antibodies can, go through me, past the placenta, and could give my child, antibodies to protect him or her when he was out. So that was my main thing. As a mom, I wanted to do whatever I could to make sure my son was healthy in COVID times. So I just talked to my OBs. I talked to him actually a couple times. It took me a couple weeks to actually fully commit to doing it. But that was what I felt was best for me and the health of my son moving forward once he was out. I didn't have any side effects really for the first 2, which was before I got pregnant. The booster, all I had was just a slight headache, but that could have been just because I was 7 months pregnant. I don't know if that had anything to do with the vaccine, but I didn't have any major complications at all. But yeah, it was definitely different because, you couldn't just have anybody and everybody there. They wanted us to wear masks when the nurses would come in the room. They didn't really want you out walking around the hallways. If you did, you needed to wear your mask. So yeah, it was fairly different than what it was obviously pre-COVID. We still have yet to really take him anywhere. He goes to see family members and doctor's appointments, but I feel better now that I had the booster, knowing that he has antibodies. So now that COVID's starting to die down a little bit, we made one trip to the grocery store, which was nice just to, get out of the house with the whole family. For me, I felt like I'm very scientific based, being in the healthcare field, that I liked, facts that I know was true. And I very much trust the doctors, if I trust them to keep my baby healthy while they're in and while they're out. So I was like, I just trusted their opinions and their medical advice that they were giving, which was to get the booster because that would keep myself protected and the baby protected. And I know that while I was pregnant, that if I would have got COVID during the end of pregnancy, that would have made my, hospital stay totally different, and it could have put myself at risk and my child at risk. So